Good morning and welcome to an all-new episode of Hatching for Health with your host, Jessica Hatch. Today we are welcoming Dr. Pham back on the show from Crescent Urology Institute, and he is joined by Sandy, Kara, and Tuck. This is a very interesting story we're going to learn about that relates to spinal anesthesia and some of the unique surgeries that Dr. Pham does. So welcome everybody to the show.
Thank you.
Thank you.
It's so nice to have all of you, including you, Mr. Tuck.
Hi.
This is your
So
first
handsome.
debut. So this is a very beautiful and unique story, just collectively with the aspect of it all. I know, Dr. Pham, you had come to me and you said, you know, there's a family, and amongst that entire family, I've operated on 6 of these little ones, and that obviously shows a lot of trust to start with, right? Doesn't it? Yeah, you must really trust him. So tell me a little bit, Sandy, how did this connection happen? Because you're the mother of your daughter, Kara, here,
Yes.
who has baby Tuck, and but you were the one who kind of seeked out Dr. Pham.
Yes. So it began, I guess, 8 years ago. When my oldest son was born, he had a little small case of hypospadias, and I went on a mission. I'm a registered nurse. I've been a nurse for 26 years, and I went on a mission to find the best pediatric urologist that there was. And I found Dr. Pham on a show. I don't remember the name of it, but he was on the show. And then from there, I just started researching what he did and reviews, and determined that he was the best, in my opinion. And I'm so glad, and we've been a client.
You're too kind.
I know.
We've been a client for 8 years now.
Yeah, for 8.
grandbaby number 6.
Even
right.
a cousin, I think y'all mentioned, had
Yes.
you had set him up for a consult,
recently.
and additionally helped with the cousin of yours.
Mhm.
So Dr. Pham, I know these have varied in types of surgeries, but these have all been done on pretty much like 12 months and younger.
I don't remember all the ages, but it would appear, right, Sandy? I think all of them were probably below
They were
a
all
year.
under a year. Yes,
Yes.
correct.
Okay.
Mhm.
Under a year.
And so a lot of, what we've talked about here recently is like the spinal anesthesia, and how that's typically something that is done only currently like on, usually 12 months and under. Being Tuck, actually, he did the spinal anesthesia option.
Yes.
Okay. So tell me about that, because I know that, it's not very common. I think even they're awake during the surgery. Your group's the only one offering it. here in
Yeah, so
Houston.
it's so in 2016, how all this kind of started. So spinal anesthesia is just a variant of an epidural. Most people know about epidural, but epidural obviously has a little bit of a higher risk, just because the higher you block in the spine, then the higher the risk. So in 2016, the FDA kind of just came out with guidance where in animal studies, if a child is under age 2, if the surgery is 3 hours or more, or if the child has had 2 or more anesthesia in animal studies,
Mhm.
then there may be learning disability. However, there's really no human studies to prove it. And so the guidance is really there, I think, but if you read their guidance on their website, it really says, do not let this guidance deter surgery,
Mhm.
and so I think it's more meant for like neurologists, or when you order imaging in children like MRI, because of radiation risk, you have to put them to sleep just because it takes about an hour to do the MRI. And so they really want the physician to really justify why you're putting these
to go
patients to
through
sleep.
that for the
And
child,
so-
like be very clear on the needs of that
Correct.
imaging.
And because of that, a lot of parents started getting really nervous. And at the same time, when I was at UT Houston Medical School and Memorial Hermann Medical Center, that's where I was working at the time, then it just coincidentally, the Mayo Clinic and us kind of started our spinal program kind of almost simultaneously. And with spinal, basically, it's kind of like a spinal tap. So the block is very low, and literally they just inject, they numb you up, and then they give the child a little bit of Precedex, which is just a medication to kind of calm them down.
Mm-hmm.
And literally they just inject some medication in there, and then you
Okay.
basically have 90 to 120 minutes from the time the needle goes in.
Okay, to
Yeah.
perform that surgery. And so, Kara, you actually had 2 children do surgery with Dr.
Correct.
Pham, and
Mhm.
I think one of them you mentioned it was a regular anesthesia at the
Mhm.
time. So did you notice like much of a difference like from the end of the surgery when they come out of it?
Absolutely. My first son, my oldest son, he woke up really cranky and screaming, crying, bloody murder for just a little while. And Tuck, he woke up perfectly fine. Like,
Because they're
He
kind of
just-
like not really waking up. They're kind of awake the whole
oh,
time,
yes, he was
right?
awake.
But
mean,
I mean,
when
naturally
I went
they're.
back to see him, he was fine.
He's just like, yeah.
Mhm.
So I mean, for a parent, like, how did that make you feel comparing like the previous surgery? Like, obviously, so much more comfortable with.
Definitely, most
Yeah.
definitely, very comfortable. I was very happy that he wasn't, because when you walk in and they're screaming or crying or upset,
Yeah, you're
it
like,
makes you
this is.
yes,
They're a baby. They're too new to
yes,
have.
yes,
Go through anything
especially
like
for
that.
mamas, then you're
And-
really tugs on your heartstrings.
yes,
Yeah, and I would love to say new moms, but we did talk, and you have 6 babies, so I will, not give you new mom credit. And so Sandy, so 2 of the surgeries took place with this daughter's children, and then you've got 3 other children,
Yes.
and the others
One
were
of my sons, he has 2 boys, and Dr. Pham did their surgeries. And then my youngest son, he did his 2 boys.
okay.
So
And some of these surgeries, I know there's an array of things that you do, whether a boy or a girl, but these are all surgeries that obviously you do at Crescent Urology Institute proudly, and it sounds like you take care of a lot of Houston and surrounding areas. It's like once somebody has had surgery with their child, or they definitely recommend you very, very strongly. So the other experiences that your children had, were you a part of like going to the hospital with those
oh yes,
as well?
I went with
Yeah.
I think pretty much everyone.
Every single one of
Oh,
them?
yeah. Yeah, and like I said before the show, being a registered nurse and mom, they depend on me a lot.
Yeah. Yeah. No, of course.
They want to recover at my house,
Yeah.
or me to go there.
They want,
Yeah.
like all that extra love.
It's some extra, home care.
Yeah. And so with Tuck's original surgery, like the circumcision that y'all elected to have, you had talked a little bit about it just wasn't performed the way that it should have been done, and that was what seeked out Dr. Pham for you.
Yes. Well, I
Um,
knew without a doubt he was the right one to go to.
Yeah,
I
like
wouldn't go
after
to
the
anybody
experiences
else.
y'all have had.
Mhm.
How common is that, Dr. Pham, that people seek you out after having had circumcision and not, I guess, being completely trimmed correctly?
Yeah, so it's hard to put a number on it because I don't
But it's
really
a revision
look.
at such a a young age, or maybe
Yeah, so I think in Tuck's situation, it's not so much as a revision, but it's a misdiagnosis.
Mm-hmm.
So meaning that, they probably, and it's very nuanced, right? So hidden penis occurs in about 10%, but not all of them need surgery. It just depends on the severity.
Mm-hmm.
And so it's very nuanced. And so if most circumcisions are not performed by pediatric urologists, they're performed by either pediatric surgeons who are not trained urologists, OBs or
Mhm.
pediatricians. So they just kind of they just misdiagnose it. That's not really their field.
Mm-hmm.
And so then they do the circumcision. So it's not really a revision per se, but I think it's
Okay.
just a misdiagnosis. And then usually they present, in Tuck's case, the skin keeps sticking
Mm-hmm.
to the head of the penis because it's not well anchored, so it keeps sinking down.
Uh-huh.
Teenagers present because, they're playing sports, whatnot, and they're like, wait a minute, why is mine looking different?
Yeah.
And so that's how, and then adult males tend to present that way also, but adults tend to think that, oh, I was just born with it, I have to accept
Mhm.
my fate, until they kind of start researching about it.
Yeah,
And they're
learning,
like,
like, that there might be something.
right.
You brought your iPad. You mentioned, I don't know how well of an artist you are, but you just mentioned like something you
Yeah.
wanted to maybe show us.
Yeah, because it's they say pictures are worth 1,000 words, and so I just kind of briefly wanted just to kind of show what buried penis really is.
Beauty.
And so,
I would be mad, but you're not crying. You're trying to communicate with us.
yeah, so, the way to look at it is, just imagine this is kind of the head of the genitalia, and then this is kind of the skin surface. And so hidden penis just kind of means it's sunken down like a turtle head.
Uh-huh.
And so it gets misdiagnosed because they don't really, you don't know what you don't know, right?
Yeah.
And so what happened is they just kind of circumcise, but then they don't understand that there's really anchors that needs to kind of hold the genitalia out and hold the scrotum and then kind of the top part of the fat pad down. And so kind of hidden penis surgery just really involves basically releasing the penis itself and then causing, extruding it.
Oh, so those anchors are almost like having to be like removed surgically?
Right.
Which would
yeah.
naturally
They're born with weak anchors. And so I would have to come in and redo the anchors. And so, really, unfortunately, it's just really hard to describe if you don't kind of anatomically draw it. So, anatomically in males, kind of have what you call the penoscrotal junction, which is really just connective tissue that kind of holds everything out. And the major problem is that parents would seek help. Parents are smarter than we think, And then they're like, something just doesn't look right. But then they go to the pediatrician, and the pediatrician, are like, and I don't know where this myth comes from, but they're like, oh, it's just the baby's a little chunky, whatever it may be. And so the chunkiness is really just an illusion. That's why insurance will never cover to pay to reduce a fat pad, because if you're skinny, then it just makes it look longer. If you're chunky, then it makes it look shorter. But the only real way to extrude it is I physically have to have my assistant pull it out, kind of like a turtle head. And then what I do is then I will, if you take a cross section here, what I do is I just put a stitch here and a stitch here, but on the cross section, of the male's genitalia is really just 2 cylinders. Maybe that's why guys just love cars, because it really is called cylinders. And really, this is kind of the scrotum, and then it's really just 2 small stitch on top and on the bottom. But the stitch is not what's going to hold everything out. Collagen and connective tissue is just going to build around there. Which, the stitch literally serves as a scaffold. And then, but the issue is if they cut off too much skin, now that it's been extruded, I have to figure out a way to get skin to cover it so that, because unlike kidney surgery where you don't need to make it look pretty, this, parents, I promise, are going to be looking at it every day for the next 6 months. And then he obviously is going to have to live with this. And so, genitalia surgeries is always one of those where it's a combination of really cosmetic surgery.
It really is.
So that, you have to make it where once it's healed, it looks like nothing ever happened. And, and the only people who will ever know would be other surgeons who specialize in this, because it just looks too perfect. And so I always tell parents as a joke, when he grows up, if he dates someone who's like, wait, that's just too perfect, and that's not, and she's not a surgeon, maybe
he's asking for credit.
Maybe we should look the other way.
That's incredible. And then I think just the aspect of, to go back to the spinal anesthesia, I mean, like nobody wants to obviously put their baby to sleep, to have something corrected, especially, it's not right here in front of us. And so, and not something that we're thinking about, for years down the road where that's actually going to be even a conversation. So it's like, it's a big decision for a parent, and to be able to come across, someone like you, Dr. Pham, and to have that confidence and see like stories like this firsthand where people are willing to come and talk about it. It says so much, right? I mean, I think a lot of things are are done that, maybe they weren't done the way that, and the parents aren't pleased and stuff. So that's not going to be on a show talking about it. And so it's it says a lot. And I just know with it being so specialized too, because I was like researching others that did, the spinal anesthesia, and it's really kind of hard to come by in Houston. I mean, you and the Mayo Clinic are really the only two that have, actual statistics showing like how successful this is.
Yeah, I mean, the only one I kind of looked up was the Mayo Clinic because I have a buddy that is a pediatric urologist there. And I kind of was just asking them what their conversion rate is. And when I say conversion rate, what I'm referring to is spinal anesthesia that goes beyond the 90 to 120 minute requiring intubation. And so because the spinal anesthesia protocol really is, once the needle comes in and they inject the medication, that includes time that they have to put IVs in, because the anesthesiologists are not going to put IV in while, the baby isn't numbed. And then you have to prep the baby. So you got to give them at least 25 minutes so by the time I start surgery, you only have that X amount of time. And so our conversion rate is almost zero. And in Houston, the only place that offers it is Memorial Hermann Memorial City.
Okay.
And they hired a specialized anesthesiologist for that.
Just for that. Incredible. So there's pretty much two places they could go is, you and Memorial Hermann. So that covers pretty much all of Houston.
Right, yeah. Well, I operate at Memorial Hermann Memorial City, and I'm the only surgeon that anesthesiologist feels comfortable doing it with because, basically he knows my time frame.
Yeah, and
so
he's comfortable with it.
Right,
for
so
sure.
We've been working together for a long time, so he knows like, okay, if Dr. Pham says he can do it within this time frame,
then it's a go. Yeah,
right, because the last thing you want is, because the protocol really is, once you put the spinal in, we literally swaddle the baby. And we give them a pacifier, and we play baby lullaby.
That's so cute.
And, well, try doing that 10 hours a day, and it's pretty painful.
New music.
And so, but yeah, we're, believe it or not, it's crazy. Houston being the 4th biggest city in the U.S., probably soon to be the 3rd biggest city, and there's no place except Memorial Hermann Memorial City. It's just crazy.
It's incredible. Well, we do have to take a commercial break, but when we come back, we're going to talk a little bit about the anesthesia, complete anesthesia that is done in comparison, and a few other things to learn more about you guys. So we'll be right back with you after this quick commercial break. Hey, welcome to Infinity Diagnostic Center and Prestige Medical Pain Clinic. We are right here in the heart of Houston, inside the 610 Loop. We do interventional pain management and we do MRIs. Our MRI facility offers a 1.5 Tesla Siemens magnet. We can do MRIs of the brain, spine, any extremity, foot and ankle. We got you covered. Then we have our pain suite. So our pain suite is for when you do have that pain. You get the MRI and now the doctor can sit and evaluate that MRI with you and look at exactly what's going on. And right here, they'll do an interventional pain injection, ESIs, transforaminal, a various amount. We've got 2 doctors on staff, so we got you covered. Before you actually get set up over here, you're gonna come to our consultation room in which you will be visited with one of the specialists. And we're treating insurance, cash patients, Department of Labor, and personal injury, which is so important. So we can take care of all of those different needs. Just come see us here at Infinity Diagnostics and Prestige Medical Pain Clinic. Welcome back from the commercial break. If you have just joined us, we have Dr. Pham here from Crescent Urology Institute, and we have a mother and her mother and their little boy with us. So we have been talking a lot about all of these surgeries collectively happening within your families that Dr. Pham has performed all of. But I just wanted to kind of talk to you personally about y'all's experience with Dr. Pham for other mothers, fathers out there, looking to have surgeries on their children, because I think collectively, just surgery in general on a baby is scary for anyone.
Yes, absolutely. It's nerve-wracking.
Yeah.
It's nerve-wracking. But I know that, especially for this type of surgery, Dr. Pham is the absolute best. I would have never, ever looked into anywhere else but him. So we, my cousin was noticing a problem with her son, and I sent her to him right away, and she was like, he is the best, most kindest, smartest doctor. We had just a really good experience with him. We really did.
And I think that's the most important thing is getting the word out to new moms.
Yeah.
That, with, little boys, if you suspect or something doesn't look right, don't be afraid to question that, or don't be afraid to make an appointment with a specialist and just get a second opinion. Don't just go off of what your OB-GYN or pediatrician says. If that gut, that you have that gut feeling for a reason. If something doesn't seem right, it's best to go and get it checked out.
Yeah, I think that's a great point. And so you have how many brothers and sisters, which is basically how many children? You have brothers and
I have
sisters?
3 brothers.
Okay. And you guys all have started a family, huh?
Yes.
Okay. And so with your brothers, you said 3 brothers? Okay. And they also have, obviously, I think they all have little ones, because she said she's going to be a grandmother of 12 come October.
They all have boys.
Okay. They all have boys.
They all have boys.
Okay.
I only have 2 granddaughters out of that many.
So that just the statistics, just speaking out loud, I mean, you've got 6 children that have had to have some sort of surgery amongst a family because you guys have so many babies. But it just shows like how many probably out there have similar conditions and they just don't know what to do, Yes. So it just makes me feel good to know that like, hey, we're sharing this, just the thought process of that. I mean, and that it's really not that rare,
It's not.
for different things.
My brother's about to have his first baby, and we told them the best advice we could give you. If it's a boy, do not circumcise in the hospital. Just go straight to Dr. Pham.
Here you go. That's the new role.
Not too much pressure now.
That's right. That's
that
right.
was the best advice. My husband even said the same thing. We all.
Yeah. Is that normally when that takes place is right after they're born, or is it within is it usually done right after they're born, circumcisions?
Typically, yes, because, that's the easiest time to do it. And there's just thousands of children born every day. And so for the most part, I think, a lot of doctors do a really good job. It's just, you don't know what you don't know.
Yeah.
And so, and there's just, like I said, I think most patients get it done in the hospital, and the ones that don't are the ones that have had a bad experience, such as, in Kara's case. But typically, yes, it is done, but as an outpatient, there's really no true cutoff, but my cutoff is 10 pounds or 6 weeks. And that just has to do with outpatient circumcision, just the way the device works. When you're kind of older than 6 weeks or heavier than 10 pounds, we don't use sutures. And so when you do it, there's just a little bit of higher risk of separation of the skin. And so, that's why I advise, generally, like I said, most doctors, probably 99% of them are fine. You have that 1% out of thousands of babies born every day. But to a parent, for them, it's not statistic. It's either 0 or 1.
That's right.
Yeah, and so it's hard. It's gut wrenching.
Yeah. So Sandy, the other 4 grandchildren that had surgeries was it hidden penis? Was it, you mentioned one other diagnosis I'm not super familiar with, but what were
one
these?
was hypospadias. And it was slight. It wasn't a severe case of it, but it was enough to need correction.
And the other 2?
And the other 5 were
were 2 being her. Okay. Yeah.
Yes, where he did the hidden penis.
Okay. Okay.
And you know what's crazy? Like I have 3 boys, and I mean this wasn't ever heard of, and there was never a problem. I don't know what's going on in the water today or what. I don't know what to think about that.
Was there also similarity with, I guess, kind of some of the foreskin being left and having that similar issue? That kind of said we need to go see a doctor for that, and then it became kind of the latter. The diagnosis of the hidden penis?
Like I think with my grandchildren, they more or less just look like maybe they were just a little chubby. Yeah. Right. In that area. But we had already found Dr. Pham, so we didn't even
Yeah, it was
take a
just-
chance
Of
of
course.
letting anyone else do the circumcisions. We just
Yeah.
went to him and let him
Oh,
do his
okay.
magic.
So he was
Mhm.
the only one. Okay,
Yes.
that makes sense.
Yes.
So why did you go? Just kidding.
Yeah.
No, I'm saying because this was the
I
last
know.
one. No,
I know.
you're like, okay, now the lesson learned.
I knew.
Kidding.
That's exactly
We
what I
wanted
said
it
after
to
the
be
fact.
perfect.
You told your yeah. Was your cousin? Was that recent? Was that
Yes, she recently, her son, but he was close to a year old
okay?
having the surgery
Yeah.
for him. So
Okay.
it's nicer to know sooner, or
Mhm.
if you kind of see that there might be something not right, or having an issue with the extra skin sticking,
Mhm.
just going sooner than later.
Yeah, definitely. So Sandy, off topic. You're a country western singer.
I am. I'm a Texas country artist. I sing country music. I just recently returned from the Texas Regional Radio Awards. I was nominated as one of the 8 future faces for Texas country music. I started late in
Incredible.
life. I didn't start till I was 50. Bought myself a guitar. I secretly taught myself to play off of YouTube. And during COVID, I released my first single, and it went 31 on the charts. And I've been releasing a new song ever since.
That is like
His favorite song is my
So-
last current single, which was called Too Many Hearts in Houston. And it was written by
I
a
like
dear
it.
friend of ours. He's 84 years old, and he's wrote, gosh, probably 200 songs, never recorded anything. Some
No
fabulous,
way.
fabulous music. And he was in the rodeo all his
Mhm.
life, and he's 84, and I thought, I want to record this song for him. I want something nice for
how
him.
special, and like
course.
special to meet him, to get a hold of that music or those
Yes.
songs that have never been able to be
Yes.
released to people.
So my current single right now is called Trouble Train, and you can find it anywhere. Spotify, Pandora, Apple
Really?
Music.
Oh, how
That's
exciting!
my current single. Mhm.
Yeah,
So-
I hope you brought something for us.
I do.
I'm
I have a
like,
few things for y'all. I've got a
good.
CD,
Yeah.
but my name is spelled different. It's Sandy with 2 E's, SANDEE.
Okay.
And then June like the month, Sandy June Music.
Okay.
.com
Is
or
that your
Instagram.
real last name, or is
That's
it your
my
middle?
name.
Okay.
That's my real name. Yeah,
That's
a lot of
a
people
great
ask
country
me. I'm
name.
being called Miss June now, but it's really my middle name, Sandy June. Yeah.
Okay.
Mhm.
And you have the 4 children that
I have
obviously
4.
care-
Kara's
okay.
the oldest,
Mhm.
and then I have 3 boys. So 37, 33, 31, and 29.
fantastic. Well, you guys have been just a pleasure being here. Y'all are beautiful. Your
Thank
son's
you.
so handsome.
Thank
Like
you so much.
next up, like I mentioned earlier, reality show for you guys.
Right, right. Life on the farm with the
And he makes
country
guest
music.
appearances. Yeah. Well, thank you all. Look forward to keeping in touch and hearing your music.
Thank you so much.
Yeah,
Thank you, Dr.
definitely.
Pham, for
Oh
having
no,
us.
thank you for
Mhm.
coming.
Thank you.
Absolutely.
Thank you, Jessica, for the invite.
Absolutely. And
Yes.
thank you all for tuning in to another episode of Hatching for Health. We'll see you right back here next Saturday. Imagine hearing the news as a parent that your child has been diagnosed with a condition that is degenerative or life-threatening. Now imagine being told that there's little to no research for that condition.